I went to medical school thinking I wanted to be an emergency room physician, but I became a general surgeon and then a trauma surgeon and then a wound care specialist. Then I left clinical medicine entirely. None of that was the plan. And yet, looking back, it all makes sense. I'm Dr. Felix Becker, and today we're talking about choosing your specialty, or perhaps more accurately, how your specialty chooses you. Welcome to In Search of 42. Here's what they tell you about choosing a specialty: do what you're passionate about, follow your heart. You'll know when you find the right one. And that's all bullshit. Or at least it's incomplete. Because choosing a specialty isn't some mystical moment where the clouds part and you suddenly know your calling. No, it's messy, it's complicated, it's influenced by things you don't even realize are influencing you. The attendings you happen to work with, the rotation schedule you happen to get, the personal circumstances you happen to be in, the jobs that happen to be available when you're looking. And sometimes, the specialty you end up in isn't even the one you chose. It's the one that chose you, or the one you fell into by necessity, or the one you discovered by accident. Today, I'm going to tell you my story of specialty choice, and I'm going to give you a framework for how to approach this decision, because it's one of the most important decisions you'll make in your medical career. And most people make it with way less information than they should have. Well, let me start at the beginning. I went to medical school thinking I wanted to be an emergency room physician. Why? Because I had done some shadowing in the ER. That was pretty much all I knew about medicine. I saw emergency physicians handling acute situations, making quick decisions, saving lives. It looked exciting. It looked meaningful. It looked like what I wanted to do. But here's the problem with that reasoning: I had no idea what else was out there. I hadn't seen surgery. I hadn't seen internal medicine. I hadn't experienced the full scope of what medicine could be. I picked ER medicine based on one limited data point. And that's what most pre-med students do. They shadow one specialty, maybe two, and they think they know what they want. They don't. They can't. Because you don't really understand a specialty until you live it, until you're immersed in it, until you see the good, the bad, and the ugly. So I went to medical school with this ER dream. And then third year happened. My internal medicine rotation came about halfway through my third year of medical school. And that's when I started to see the reality of emergency medicine. Because on internal medicine, I was admitting patients from the ER. And I started to notice a pattern. A lot of the ER visits weren't true emergencies. They were people who couldn't afford primary care, people coming in for blood pressure medication refills, people coming in for diabetes medication refills, people using the ER as their primary care physician because they had no other option. And that put me off. Not because I looked down on those patients, but because I realized that ER medicine wasn't what I thought it was. It wasn't all the trauma and resuscitation and life-saving interventions. A huge portion of it was primary care for people who couldn't access primary care. And that simply wasn't what I wanted to do. I had an identity crisis at that point because my entire plan for medical school was based on becoming an ER physician. And now I was realizing that wasn't the right fit. So instead, what was? I had no idea. Then came my surgery rotation, and here's where it gets interesting. I had always said I never wanted to be a surgeon. You know, the lifestyle, the ego, the culture, none of that appealed to me. But I had to do a surgery rotation. Everyone does. And I made a strategic choice. I chose the pediatric surgery elective. This was the rotation designed for students who didn't want to do surgery. It was known as the easy surgery rotation. The attendings were nice. They got everyone involved with cases. There was no hazing, no abuse, no standing in the OR for 12 hours holding retractors while being pimped mercilessly. It was surgery without the toxicity. And that's where I fell in love with it. I love the hands-on approach. I love the immediate results. You see a problem, you fix it. You close, you're done. Not months of medication adjustments and follow-up visits. Not endless diagnostic workups. You operate and you solve the problem. That appealed to me. The decisiveness of it, the technical skills required, the problem solving. But here's the irony. The reason I fell in love with surgery was because I avoided the toxic culture. If I had done one of the hard surgery rotations, the ones designed for students who wanted to be surgeons, I probably would have been turned off because those rotations were brutal. Toxic attendings, hazing, abuse disguised as teaching, medical students treated like they were worthless. I saw my classmates come back from those rotations traumatized, crying, questioning their career choice. And those were the students who wanted to be surgeons. So the culture was actively driving people away from the specialty. But I got lucky. I took the easy rotation and discovered I actually loved the work. Here's the first major lesson about choosing a specialty. The culture matters more than the content. You might love the intellectual work of a specialty, but hate the culture. Or you might be ambivalent about the work, but love the people you're working with. And culture is going to determine your day-to-day experience more than anything else. I've seen brilliant students avoid specialties they would have been great at because the culture was toxic. I've seen average students thrive in specialties because the culture was supportive. Culture is everything, and you need to pay attention to it when you're exploring specialties. Don't just ask, do I like this work? Ask, do I like these people? Do, do I respect how they treat each other? Do I want to become like the attendings I'm working with? Can I see myself in this culture for the next 30 years? Because if the answer to any of those is no, it doesn't matter how much you love the work. You will burn out. You will be miserable. You will leave. So I decided on surgery, despite saying I never wanted to be a surgeon, despite avoiding the specialty initially. I realized it was the right fit for me. But here's another wrinkle. To apply for a surgery residency, I needed letters of recommendation. And I needed one from our chair of surgery, which meant I had to do a fourth-year elective with him. Surgical oncology, one of the hard rotations. And it was everything I had avoided during third year. Toxic, demanding, hierarchical. But I needed that letter. So I sucked it up and I did it. And thankfully, I got through it and got the letter I needed. But it reinforced something I already knew. Not all surgery programs would be a good fit for me. I needed to find a program with a supportive culture, a program that treated residents like human beings, not a program that would grind me down and spit me out. I applied to a lot of residency programs, looking for prestige, research, recognition, and I ranked them accordingly. And on match day, I opened my envelope. Abington Memorial Hospital, a community program just outside Philadelphia. My third choice. And I was the only person from my entire medical school class who didn't match into an academic program. Everyone else went to big name university programs. And there I was, heading to a community hospital. I felt like I had failed somehow, like I wasn't good enough for the academic programs. But you know what? Abington turned out to be phenomenal. Better than any academic program would have been for me. Why? Because they focused on teaching basic general surgery principles, not subspecialty fellowship training, not research, not academic politics, just good, solid surgical training. The attendings were all in private practice, so we learned from them about the business of medicine as well. We learned how to actually run a practice. We learned practical skills that academic programs don't teach. And the culture was supportive, not toxic, not hierarchical in a destructive way. The attendings treated us like future colleagues, not like servants. So my failure to match into an academic program turned out to be one of the best things that happened to my training. And here's the second major lesson. Prestige isn't everything. In fact, prestige might be nothing. The best programs on paper might be the worst programs for you. The big name university program with the famous attendings might have a toxic culture. The community program that nobody's heard of might give you better training and better mentorship. You need to evaluate programs based on what matters to you. Not what matters to US News rankings, not what matters to your medical school advisors, not what impresses your parents. What matters to you. What kind of training do you want? What kind of culture do you thrive in? What kind of attending do you want to become? And then find the program that will help you get there. Even if it's not prestigious, even if nobody's heard of it, even if it's your third choice. Well, I finished residency. I now was a general surgeon, and I owed the Air Force 3 years. They assigned me to C-STAR St. Louis, the Center for the Sustainment of Trauma and Readiness Skills, a civilian trauma center where military surgeons train. Here's the problem. I had very little trauma experience from residency. Abington wasn't a major trauma center. We did some trauma, but not a lot. And now I was being stationed at a trauma training center for the military. I was expected to be a trauma surgeon. So I had to learn on the fly. My very first consultation as an attending was actually a case of Fournier's gangrene. And for those who don't know, that's necrotizing infection of the genitals. It's usually a urologic emergency, but we didn't have urology coverage. So it came to me. And it wasn't just Fournier's gangrene. It turns out this patient had a colovesical fistula, a connection between his colon and his bladder, that he had known about, but had been lost to follow-up. Well, this connection had ruptured. He had spilled stool into his preperitoneal space and down into his scrotum. I had never seen anything like this in my residency training. I didn't even think something like this was possible. And it was my first case as an attending. I called my backup surgeon for the day. She came in to help, no problem. We figured it out together. It all worked out in the end, both for me and the patient. But that experience was emblematic of my early trauma career. I was thrown into the deep end. I had to learn by doing. I had to ask for help when I needed it. And somehow I survived. More than survived, actually. I thrived. I ended up loving trauma surgery. Not because I had chosen it, but because it chose me. And because of the people. The team at St. Louis University was incredible, supportive, collegial, collaborative. We took care of each other. We taught each other. We had each other's backs. That camaraderie, that team dynamic, that's what made trauma my jam. Not the cases themselves, but the people. And that's something I still miss to this day. Working with them, being part of that team. So when my Air Force commitment was up, I decided to do a fellowship, a formal trauma and critical care fellowship, because to do trauma at a major center, you really should be fellowship trained, especially at a level 1 trauma center like St. Louis University, and I wanted to continue my trauma career in the civilian world. So I did the fellowship, got the training, got the certification. And then I moved to Toledo, Ohio for personal reasons, and I started looking for trauma jobs. And there were none. No one was hiring a general surgeon or a trauma surgeon in Toledo at the time. And that's how I ended up in wound care. Not by choice, by necessity. I needed a job. Wound care was available, so I took it. And you know what? Wound care has become my jam. I have a knack for it. I'm good at it. Here's the thing. As a surgeon, I was always trained on how to inflict wounds, how to cut, how to remove, how to operate, but I was never really trained on how to heal wounds, especially chronic wounds. And chronic wounds are a big deal. There's a true science to it. The biology of healing, the factors that prevent healing, the treatment modalities. It's fascinating. It appeals to that part of my brain that loved physical chemistry back in college. The problem solving, the systematic approach, the seeing the world through equations and processes. Plus, the hours are so much better. No nights, no weekends, no call. I can have a life outside of work. I can pursue other interests. I can coach. I can do this podcast. I can still dabble in coding and automation and follow soccer. Wound care gave me my life back. So, do I regret not doing trauma anymore? Some days, yes. I miss the people. I miss the camaraderie. I miss the team dynamic. But I mostly romanticize it because I don't miss the hours at all. I don't miss being called in at 2 a.m. I don't miss the physical and emotional exhaustion. I don't miss sacrificing my entire life for my career. So, wound care, the specialty I fell into by accident, turned out to be a better fit than the specialty I chose and trained for. Here's the third major lesson: your path isn't linear, and that's okay. You don't have to know exactly what you want to do from day one. You don't have to stick with your first choice forever. You don't have to follow the traditional path. Life happens, circumstances change, you change, and your career needs to adapt to that. I went from wanting to be an ear physician to becoming a general surgeon, to becoming a trauma surgeon, to becoming a wound care specialist, to leaving clinical practice entirely. That's not failure. That's evolution. That's adaptation. That's taking ownership of your career and making it work for you, not the other way around. So, when should you start thinking about your specialty? My answer: as soon as you decide on medicine, but with an important caveat: keep an open mind. Start the conversation early, but don't close any doors. Here's what I mean. If you're a pre-med student or a first-year medical student, start exploring. Talk to physicians in different specialties. Shadow if you can. Read about different fields. Go to specialty interest group meetings. But don't commit to anything yet because you don't have enough information. You haven't done your clinical rotations. You haven't experienced the reality of different specialties. You haven't discovered what you're actually good at versus what you think you want to do. I went to medical school thinking I wanted ER medicine. I had an identity crisis during third year when I realized ER wasn't for me. And then I discovered surgery on a rotation I took specifically because it was easy. None of that was predictable. All of it was essential to finding the right path. So, start early, but stay open. Explore broadly. Ask questions. Pay attention to how you feel during different rotations. Not just whether you like the content, but whether you like the culture. Whether you respect the attendings. Whether you can see yourself doing this for 30 years. During your third year rotations, here's what you should be evaluating. First, do you like the actual work? Not the idea of the work, the actual day-to-day tasks. If you're on surgery, do you like standing in the OR? Do you like the technical aspects? Or do you find yourself bored and wishing you were somewhere else? If you're on internal medicine, do you like the diagnostic puzzles? Do you like managing chronic diseases? Or does it feel tedious and unsatisfying? Be honest with yourself about what you actually enjoy versus what you think you should enjoy. Second, do you like the culture? How do the attendings treat each other? How do they treat the residents? How do they treat the medical students? Is there mutual respect? Is there psychological safety? Or is it toxic and hierarchical and abusive? Because that culture is what you're signing up for. Third, do you like the lifestyle? What are the attendings' lives like outside of work? Do they have families? Do they have hobbies? Do they seem happy? Or do they seem burned out and resentful? Because that could be your future. Fourth, do you respect the attendings? Not just their medical knowledge, but who they are as people. Do you want to become like them? Because you will. The attendings you train under will shape you, for better or worse. Fifth, what are you naturally good at? What do the attendings and residents praise you for? What comes easily to you? What do you struggle with? Sometimes the specialty you're good at isn't the one you thought you'd love, and that's worth paying attention to. Find mentors in different specialties, not just the specialty you think you want. Multiple specialties, and ask them the questions nobody asks. What do you wish someone had told you before you chose this specialty? What's the worst part of your job? If you could do it over, would you choose the same specialty? How has this specialty affected your personal life? What does a typical week look like for you? How much autonomy do you have? How much is your practice driven by insurance and administration versus your own clinical judgment? These questions will give you information you cannot get from a textbook or a specialty brochure, and they'll help you make a more informed decision. Also, find mentors who have changed specialties or left clinical practice, because they can tell you what it's like to pivot, what it's like to realize your first choice wasn't right, what it's like to start over. That perspective is invaluable. Now, here are some red flags during your exploration. Everyone in the specialty seems miserable. If every attending you meet is burned out, bitter, and counting down to retirement, that's telling you something. The culture is abusive. If residents are being hazed, if medical students are being humiliated, if there's no psychological safety, run. That culture will not magically improve once you're a resident or an attending. Another red flag is you can't imagine doing this for 30 years. If you're already dreading the lifestyle during your rotation, it's not going to get any better. You're only choosing it for external reasons. If you're choosing it because of prestige or money or parental expectations, or because you think you should, stop. Those aren't sustainable motivators. Another red flag is you love the idea but hate the reality. If you love the concept of the specialty, but you're miserable during the actual day-to-day work, pay attention to that. The reality matters more than the idea. And here are some green flags. Time passes quickly. If you're engaged and energized and the day flies by, that's a good sign. You're thinking about cases outside of work, not in a stressed way, but in a this is intellectually interesting kind of way. You respect and like the people. If you genuinely enjoy working with the attendings and residents, that matters. You can see yourself in their lives. If the attendings have lives you admire, families you respect, balance you want, that's telling you something. Another green flag is you're good at it. If people are telling you that you're a natural, if things come easily, if you're getting positive feedback, pay attention to that. If it aligns with your values, if the work feels meaningful in a way that resonates with who you are, that's important too. Now, when I became an attending, I made a conscious decision about how I would treat residents. I would treat them as colleagues, not as subordinates, not as servants, but as future colleagues. What did that look like practically? Well, I asked residents for their thoughts and opinions. What do you think is going on with this patient? How would you approach this case? What's your plan? I let them run the show. I gave them autonomy to make decisions. With supervision, of course, but I let them lead. Because that's how you learn to be an attending. Not by being told what to do, but by doing it yourself with a safety net. I never hazed. I never humiliated. I never made residents feel stupid for asking questions because I remembered what it was like to be a resident. I remembered the toxic attendings I trained under. I remembered how demoralizing it was to be treated like you were worthless, and I refused to perpetuate that culture. If you become an attending, you have a choice. You can perpetuate the toxic culture you experienced. I suffered, so you should suffer too. Or you can break the cycle. You can be the attending you wish you had. You can create the culture you wish you had trained in. That's taking ownership. That's making medicine better. Now, let me address something else. I did a trauma and critical care fellowship, a full year of additional training after already doing 5 years of general surgery residency. And then I ended up in wound care. I never used that fellowship training in a meaningful way. Do I regret it? Well, yes and no. Yes, because it was a year of my life, a year of delayed income, a year of additional training for a career I'm not doing anymore. That feels like wasted time. But no, because that training taught me things I use every day: critical thinking, managing complex patients, working under pressure, collaborating with teams. Those skills transfer. And that year gave me credibility. It opened doors that wouldn't have been open otherwise. Even if I'm not practicing trauma anymore, that fellowship still matters on my CV. It tells people I'm serious, I'm trained, I'm competent. So was it worth it? I don't know, but I don't dwell on it because dwelling on past decisions is pointless. You make the best decision you can with the information you have at that time, and then you move forward because that's extreme ownership. Here's my advice for choosing a specialty. 1. Start the conversation early, but keep an open mind. Explore broadly during your first 2 years. Don't commit until you've experienced the reality of different specialties. 2. Pay attention to culture, not just content. The people you work with matter more than the work itself. Choose a specialty where you respect and like the attendings. 3. Trust your gut during rotations. If you're energized and engaged, that's a good sign. If you're counting down the hours until the rotation ends, well, that's a bad sign. 4. Prestige doesn't matter as much as you think. The best program might be the worst program for you. Find the program that fits your needs and your values. 5. It's okay to pivot. Your first choice doesn't have to be your forever choice. Circumstances change. You change. Your career can change too. 6. There is no perfect specialty. Every specialty has trade-offs. Every specialty has challenges. Find the one where the trade-offs are worth it to you. 7. Don't let fear make the decision for you. Don't choose this specialty because you're afraid of the alternative. Choose it because it's genuinely right for you. 8. Get help making the decision. Talk to mentors, talk to peers, talk to people who have changed specialties. This is too important a decision to make alone. And 9. Remember that specialty is only part of the equation. Practice setting matters. Geography matters. Relationships matter. Your life outside of medicine matters. Don't optimize for specialty alone. Finally, take ownership of your career. You're not a victim of circumstance. You are not stuck. You always have choices. They might not be easy choices, but they are choices. Own them. I went to medical school wanting to be an ER physician. I became a general surgeon instead, then a trauma surgeon, and now a wound care specialist. I did a fellowship I never really used. I ended up in specialties I never planned for. And somehow, it all worked out. Not according to plan, but it worked out. Because I stayed open. I adapted. I took opportunities as they came. I learned from my experiences, and I owned my choices. Your path will be just as nonlinear, just as unpredictable. And that's okay. Start the conversation early. Stay open. Pay attention. Trust yourself. And take ownership of your career. This is In Search of 42. I'm Dr. Felix Becker, and your specialty is waiting for you to find it or for it to find you. If this episode resonated with you, hit that like button and subscribe. Leave a comment about your specialty choice journey. Are you still figuring it out? Did you end up somewhere unexpected? What advice would you give to students trying to choose? Let me know what else you want me to cover, and I will see you in the next episode.